So Life Healthcare had a solid trading performance for the 6-month period ending in March this year. Now, it was largely driven by a strong performance in its Southern Africa business as economic conditions improved and, of course, the severity of COVID-19 diminished. We've got Peter Wharton-Hood, who is the Chief Executive, who joins us now to talk about the numbers that they saw in the period. Thank you very much for your time this evening, Peter. As I mentioned in my intro, a solid set of numbers, and one of the things that comes through is that higher demand for healthcare services, but also disruptions by the pandemic really declining quite significantly.
Exactly, a great summary, and the financial results that we have reported don't actually record the level of increase in our underlying activities. And that's a technical observation because the base period against which we're comparing this half year's financial results included the profit on the sale of our operation in Poland, and it also included the revenue that was generated from a once-off contract that we had with the NHS in England to deliver emergency-type COVID services to address the backlogs that had presented themselves during the first half of last year. So when one looks at the underlying level of activity, it's significantly more or higher than the way that the profits have panned out. And we can see not only the increase in underlying activity in England or in the UK, where demand for our services went up by more than 13.5%, and PET-CTs are now 37.5% higher than they were in 2019. But in Ireland, where the government is also trying to reduce the significant backlogs, our underlying volume went up by 26%. So yes, underlying activities, strong performance.
No, absolutely. You were also able to declare 15 cents per share for the dividend in the period. Was this the original guidance that you had shared with shareholders?
No, and I think that we made that deliberate decision based on bearing in mind that we had a very difficult Q1. The hospital complexes in South Africa suffered the ill effects of 2 COVID waves, which left our hospitals in December particularly empty, no elective surgeries, and thankfully for society, the COVID conditions didn't put lots of patients in hospital, but clearly empty hospitals aren't profitable for us. The second quarter showed a real return to high-level occupancies in our hospital complex, and on that basis, the board decision which we took yesterday was to declare a dividend based on the positive outlook for the company, the strong balance sheet position that we have with a balance sheet that's just 2 times geared to EBITDA. And we thought it was the right message to be sending.
No, absolutely. Now, talk us through some of the challenges, one of the most recent being the KZN flooding. How has Life Healthcare navigated this, and was your infrastructure or operations in KZN materially affected at all?
Well, our concluding statement around our outlook is how resilient the management teams actually are. This is the same team that weathered 4 COVID waves, and we're now in the 5th. The civil unrest, 2 bouts of flooding in KZN, and infrastructure challenges and power outages. The challenges never seem to stop, but these teams have done particularly well. And the more recent flooding, and our condolences to those people that have been severely impacted by it. Yes, we had flooding in some of our hospitals, we had water shortages in some of our hospitals, and we had infrastructure challenges that we had to address. But I'm thankful that the team rallies to the cause. They've learned the lessons of past challenges, and they continue. And it's that demonstrable resilience that gives me the comfort to be able to be optimistic that even if there are challenges or headwinds on the horizon, this team knows how to deal with them.
No, absolutely. Just a final thought from you, Peter. My colleague Sally was just speaking about vaccinations in South Africa and really the drive there. Are you concerned about the slowdown that we've seen in the country, some hesitancy that still exists? And does it make you think about the future waves that are to come and the severity that may come with them?
Perhaps to answer that question in 3 parts. We think we are in the middle of wave 5. And to contrast that to what happened in the Delta wave, Life Healthcare Group had just over 300 COVID hospitalizations. Compare that to 2,300 at the peak of the Delta wave. Hospital admission death rates in Delta wave, 1 in 5 patients admitted to Life Healthcare passed away. That number is now 1 in 50. So what we are seeing is a softening of the severity of the disease. But there are extensive clinical trials, particularly in the US and the United Kingdom, that are showing that vaccinated people that have suffered the disease are less likely to suffer the long-term effects of long-term COVID. Long-term COVID is a reality, and it's going to place a burden and responsibility on the healthcare institutions. So what we are seeing is, although it's less likely that we will have hospitals crammed full of COVID patients, the impact on society is still there. And in that sense, we know how to run our hospitals now with COVID as an endemic virus as opposed to a pandemic virus. And that's the reason why we think we're getting back to levels that are pre-COVID type levels in the way that we expect to be able to run our business.
Sure.
So that's how we've summarized the outlook. But vaccination is critical. If we look at our own life healthcare statistics across our own workforce, and we correlate that with the impact that it's had and improved the outcomes for our own staff, the maths is unbelievable. And we've got just on 90% vaccination across our entire workforce and 100% vaccination in our head office. We are completely pro-vax, and the maths inside life healthcare completely validates the strong stance that we've taken.
No, absolutely. Very interesting insights there, Peter Wharton-Hood, who's the Chief Executive of Life Healthcare, joining us to speak about the results that they released today.